Good afternoon, my name is Chloe and I'm going to be your student nurse today. Can you please verify your name and date of birth for me?
Ashton Carden, May 20th, 2006.
Okay, go ahead and provide patient privacy. I'm going to wash my hands. Then, I'm going to go ahead, put on my gloves. Alright, and before we begin, I'm going to make sure that I have an order from the doctor to do a neurological assessment, as well as a head, ears, eyes, nose, and throat assessment. Okay, so I'm going to go ahead and ask you a couple questions. Have you had any, do you have any allergies?
No.
Okay. Are you currently taking any medications?
No.
Do you have any cultural beliefs or practices that you'd like to try to incorporate today?
No.
And do you have any health goals that you'd like to try to incorporate today as well?
No.
All right, I'm also trying to make sure I have all of my supplies together, which will include something to document my findings with, a pen, and my pen light, and also my gloves, which I just put on. All right, so do you have any pain today?
No.
Well, if you do feel any pain or discomfort, just let me know and we'll stop right away. Okay? And just to make sure there's no railings here either, so just be careful, okay? And are you comfortable where you're at?
Yes.
All right, so we're gonna go ahead and start. Is that okay? Just gonna ask you to drop straight out for me on the T. Just keep them up there. Can you tell me what time it is?
3:50.
Okay. Also, can you tell me where we're at today?
The doctor's office.
Okay. And what are we doing today?
Head, ears, eyes, nose, and throat check.
Okay. And do you remember my name?
Chloe.
Go ahead and squeeze my hands. Good job. So we're gonna go ahead and start with the head, okay? Have you had any head trauma or injury to your head recently?
No.
And do you have a family history? Do you have a history of family headaches or migraines?
No.
You can go ahead. Going to look at the head. Going to look at the size, the symmetry, any abnormal facial expressions. I'm also going to look at the position of the head. The position is in the midline of the body, which is good. I don't notice any abnormal facial expressions. The size and the shape look good in relation to the patient's height and the patient's age. I also would look at the symmetry, and both sides of the head are symmetrical as well. I'm going to go ahead and touch your head, okay? All right. I'm going to be feeling for any lumps or any masses. Does this hurt anywhere?
No.
Okay. Also going to be noticing the hair distribution. It looks nice and even. All right, so the next thing we're going to do is we're going to look at your eyes. Have you had any eye or vision problems recently? Have you noticed any changes in your vision?
No.
And do you ever see spots in your vision?
No.
Okay. Do you ever have any pain or sensitivity to the light?
No.
Okay. Assess your eyes. I'm going to start by looking at the outer eye. I'm looking at the color and the alignment. The alignment looks good and the color looks good as well. Okay, go close your eyes for me. Going to be looking at the eyelids. Excuse me. I'm going to look for any lesions, edema, or lid lag. I don't notice anything. The color looks good and the eyelids are smooth. And they're the same color as well on both sides. All right, I'm going to go ahead and pull on your eyes just a little bit. Going to look at the conjunctiva. It's nice and pink. The eyes are moisturous, which is good. I'm also looking at the lacrimal ducts and glands. I don't notice any drainage or any edema, which is good. All right, you can look up for me. Looking at the sclera, it's nice and white, and I don't notice any presence of any lesions. All right. Now I'm going to shine this in your eye, and it may be a little bright, but it shouldn't hurt, okay? Now I'm going to be looking at the pupils and the iris. Just follow the light for me. The pupils look good. They are round, reactive to light. The iris looks good in color as well. All right. Now, if you follow this pin, okay? All right. Good. Just a little bit more. Just gonna go in and follow it for me. All right, and the pupils are accommodating too, which is good. Now we're going to be moving on to the ears, okay? Have you had any hearing problems recently?
No.
And have you noticed any ringing in either of your ears?
No.
Okay. Okay. So I'm going to pull your hair back. I'm going to look at the external ear. I'm looking for the placement, the size, shape, and the symmetry. The placement looks good. Both ears are symmetrical. The size and the shape look good as well. All right, now I'm going to look at the skin around the ear. Looks good. I don't notice any redness or any lesions. Good. All right. I'm going to look in your chin line, okay? All right. Now I'm looking for any drainage or any lesions. I don't notice any. This one. Awesome. No drainage, no lesions as well. Chloe. Still fine. Okay. You're still right. All right, now we're going to be looking at your nose, okay? All right. Have you had any nose or sinus problems recently?
No.
And do you have often allergies?
No.
Okay. And how is your sense of smell? Would you say it's pretty good?
Yeah.
Okay. So, all right. So if you'll take a deep breath in through your nose for me. Good. Seems nice and clear. Now I'm going to be looking at the position and the shape and the size. The position is in the midline of the body, which is good. The shape looks good as well. And the size is normal, which is good. All right, I'm going to feel right here and tell me if this hurts, okay? Does it hurt? Okay, I'm going to feel up here too. Does that hurt?
No.
Awesome. All right, I'm going to shove this in your nose as well. All right, going to look for any drainage. I don't see any. And the nostrils are flaring appropriately, which is good. Now we're going to be taking a look at your mouth. Have you ever had any mouth or teeth problems?
No.
Okay. Have you ever had any cavities?
Yeah.
You got them taken care of though?
Yes.
Okay. Alright. So the first thing I'm going to do is I'm going to look at the lips. I'm going to look at the placement. I'm going to be looking at the skin around it and the color and the condition of the lips. The color is nice and pink. The condition looks good. No lesions. The placement is in the midline of the head, which is good as well. Alright. Now, if you'll just open and say ah for me. Alright. I'm looking at the oral mucosa. It's nice and pink and moisturous. Looking at the teeth. They look good, nice and white. Alright, I'm going to pull down right here and look at your gums, okay? Gums look good as well. The gums are moist. Everything looks good there. Awesome. Alright. Now I'm going to be taking a look at your neck and your throat, okay? Have you ever had any neck stiffness when you're swallowing?
No.
Okay. Have you ever had any difficulty swallowing?
No.
Okay. And have you ever had any history of thyroid disease?
No.
Okay. Awesome. Alright. So if you don't mind, I'm just going to ask you to swallow for me. Good job. Alright, now I'm going to look at your thyroid. And don't mind, I'm just going to ask you to scoot up for me, okay? That's what you need to access it is behind. Alright. Palpating the thyroid. Feels good. Doesn't seem to be swollen. Alright, I'm also going to take a look at the lymph nodes. Good. Feel good. Alright, awesome. Alright, so everything feels normal and feels the appropriate size as well. Alright, so that includes our assessment. Now, are you currently in any pain?
No.
Okay, awesome. Did I do anything to make you feel in pain or anything?
No.
Okay. Do you have any questions, comments, or concerns for me?
Mm-mm.
And is there anything that can get you?
No.
Okay. Well, I'm going to give you this call line right here. If there's anything you need, you ring this call light and I'll be back right away, okay?
Okay.
All right. And then the last thing I will do is I will document my findings to the client's baseline. And that is all. Thank you so much for your time.